Hello, I am Haider. I will explain the Jefferson fracture. At the beginning, C1 or the atlas, it sits just inferior to the occiput and through its articulations with C2 and the occipital condyles joins the skull to the spine. This allows for lateral and vertical mobility of the head, and upper spine. The atlas has, in contrast to the other vertebrae, no body. Function. They are labeled C1 through C8. They stimulate muscle movement in your neck, shoulder, arm, and hand, and provide sensation. Cervical nerve C1, C2, C3. They control forward, backward, and side head and neck movements. As we see here, anatomical structure of the atlas, which composed of transverse process, transverse foramen, superior articular surface of lateral mass for occipital condyle, groove for vertebral artery, posterior tubercle, posterior arch, vertebral foramen, lateral mass, articular facet for dens, and anterior tubercle, and of course anterior arc. Vertebra is a bony ring with two wedge-shaped lateral masses connected by relatively thin anterior and posterior arcs and a transverse ligament. The lateral mass on vertebra C1, who is taller, is directed laterally. Therefore, vertical forces compressing the lateral masses between the occipital condyles and the axis drive them apart, fracturing one or both of the anterior or posterior arcs. The impact forces cause an outward spread of the lateral masses of C1. A Jefferson fracture doesn't always result in a spinal cord injury because the dimensions of the bony ring increase, and the spinal cord injury is more expected if the transverse ligament has also been ruptured. Etiology: 10% of injuries to the cervical spine are fractures of the atlas and 2% of all spinal injuries. Everyone can have a cervical spine injury, but it's rare in children. The incidence is only 1 and 10% to 9 and 5% of all cervical injuries. The injury in children due to falling at the playground. The Jefferson fracture occurs most likely because of a diving accident striking the bottom of the pool, with hyperextension of the cervical spine, or may result from an axial load on the posterior side of the head. It may also result from an impact against the roof of a vehicle. Clinical presentation. There are different kinds of fractures of the atlas. The study from Gibor says that there are 4 types of fractures depending on the speed of axial pressure. They are different from each other because the place of the fracture isn't the same. They are anterior arc fracture, posterior arc fracture, anterior and posterior arc double fracture, and lateral mass fracture. Clinical presentation. The study says the fractures result from an axial force on the vertebra at slow speed and at high speed. They used an axial force application at constant speed of either 0 and 5 millimeters on the second or 300 millimeters on the second. The results show us that at slow speed 13 to 20 fractures were type 4 fractures. The results at high speed are type 3 fractures, burst fractures of 2 to 4 parts, and type 3 fracture occurred in all 20 tested specimens. Their conclusion is that the type of atlas fracture depends on the speed of axial force impact. Physical therapy management. Patients with a Jefferson fracture must be diagnosed for injury with X-ray films. Patients may present with unstable or stable Jefferson fractures. Patients with an atlas fracture are most likely to undergo a surgical treatment A case report found that a treatment of unstable burst fracture of atlas Jefferson fracture is controversial. And thank you very much.